Andrew, as usual, Texas did a great job applying for funding. I'm curious, what were the COVID-19 related needs you're seeing from some of your funding applicants?
Since we are still currently in that open application window, we really don't have a full picture of agency needs yet. But what we are seeing so far is the majority of funds being sought for personnel. So that's going to include peace officers, jailers, fire, EMS, and specifically costs around overtime, hazard pay, costs associated with quarantine staff as well. After personnel, we're seeing a lot of requests for PPE, sanitization, equipment supplies, and as well as technology solutions. But I think it's more important to note that the question that we're currently more focused on answering is not necessarily what are the largest needs, but more centered around which source of federal funds do we use to target those specific needs. As I'm sure you're aware, the CARES Act authorized multiple avenues of funding to the states through BJA, through FEMA, through the U.S. Treasury Department, as well as giving us considerable latitude in deciding how to distribute those funds across the state as well as local government. Governor Abbott did recently announce a governor's strike force to reopen Texas with the mission to safely and strategically restart and revitalize all aspects of the Texas economy. Within this strike force is a fiscal accountability and federal liaison work group consisting of state leaders from each of the agencies administering these various sources. Work group members are sharing information regarding applicants, needs, guidance, and coordinating regularly in an effort to direct locals to the most appropriate resource and really prevent that duplication of benefits.
That's fantastic, Andrew. Is it fair to say that the supplemental funding is providing a fairly significant filling of gaps in some of the resources that you may have had available for law enforcement and first responders?
Most definitely. The CSF program was the first avenue of funding made available through the CARES Act to Texas. Because of this, Texas did make the decision to prioritize the entirety of our state allocation to the local units of government as well. Most local agencies maintain a small supply of PPE and other disaster-related equipment through their emergency management departments. But the significant majority of agencies were ill-equipped to handle the level of supplies needed to properly combat the COVID-19 pandemic on a long-term basis. I think it's also important to note here is that the impact on having to quarantine staff as well, the exposure risks associated with COVID-19 has led to jailers, peace officers, and other first responders having to be taken off shift and placed on a leave status for upwards of 14 days. These agencies still need to provide the same level of service to Texans, and losing frontline officers for significant periods of time placed a lot of hardships on not only those agencies, but also other responders who have to work additional shifts. The CES program has allowed us to reimburse these local agencies for some of those immediate needs, specifically, like I said, PPE, sanitization, and other first responder overtime.
Andrew, what kinds of problems do you imagine might have arisen in Texas if you hadn't had access to this funding?
Interesting question. As you know, shelter-in-place orders, social distancing guidelines, and other COVID-19 restrictions have really led to significant loss of revenues for cities and counties through various tax bases. In the realm of the criminal justice system, this translates into declines in probation fees, court costs, and fines, which are commonly used to fund public safety departments. Obviously, this loss of revenue, coupled with an increase in demand for public safety services, has really led to a 1-2 punch on first responder resources. The loss of revenue problems would exist whether or not Texas received these funds, but what the program has allowed us to do is to mitigate some of the financial burdens local agencies are experiencing as they combat this pandemic.
With this new funding, where are you seeing most of the new resources allocated? I know we've heard concerns in the jails and prisons, and a variety of resources among law enforcement. But is there a particular focus of the new resources, and what is that?
Good question. The vast majority of requests really aren't new or novel per se. Like I said, we're seeing a lot of PPE, overtime, sanitization, But on the technology side, we have seen some newer resources being requested that I think are good use of these funds. We're already starting to see funding requests for contactless dispatch systems that allow residents to report non-emergency calls online, and officers are able to follow up electronically to actually determine if an officer is needed on scene. We've also seen video magistration as another technology that we're starting to get requests for. It essentially allows for certain court proceedings to occur from inside the jail environment. I think it's important here to note that these are all really good examples of everlasting change brought on by the CESF program. These are all technologies that once implemented will allow for long-term savings as well as lower security concerns of transporting offenders from the jail to the courthouse.
Is the coronavirus creating challenges you haven't seen before for public safety officers, as well as for those across the criminal justice system?
Well, infectious disease is not new to the criminal justice system. Jails and first responders have long dealt with issues around tuberculosis, HIV, hepatitis, and even annual influenza outbreaks. What is new here is the pandemic nature of COVID-19 and the elongated period of time we're having to combat it. On top of that, we also have to be mindful that abrupt changes to the administration of the criminal justice system can have impact at different points in the process. For example, here, the Texas Department of Criminal Justice has put a temporary hold on receiving newly incarcerated inmates from county facilities to essentially slow the spread to the state correctional population, which is, a very real concern. This has led to counties experiencing higher housing costs for inmates awaiting transfer to a state prison to serve their sentence. Texas is actually utilizing the CESF award to allow counties to be reimbursed for these housing costs in order to help prevent and slow the spread. While COVID-19 brings challenges, I believe Texans are an innovative group. COVID-19 prevents us an opportunity to really reassess how we deal with public health crises in the criminal justice system. What technologies can we implement into the system that allows continuity of operations if this were to happen again? How can we utilize the CESF program to upgrade technology infrastructure to more efficiently administer justice? We have an opportunity here through this program to upgrade systems that are decades old and make improvements where local agencies wouldn't normally have the resources to do so.
Andrew, thank you so much for joining me today. Fascinating what's going on in the state of Texas. I know you guys have a very, very big chore dealing with a wide range of issues across the state. We're very happy you guys were early to get your application in so you can get those resources out to not only the urban areas, but the rural areas as well. Thanks so much for all you do. It's been great talking with you.
Yes, thank you to you, Mike, as well as to the Bureau of Justice Assistance for allowing this source of revenue to really hit the state in a very efficient manner. Like I said earlier, this is the first source of revenue or funds that we've received through the CARES Act, and we're looking forward to really getting it down to the local level where those resources are needed most.